Hello everybody, welcome to my presentation on the Rogerian method, also called the person-centered approach and motivational interviewing. This presentation is for the MSAN Class 620, and my name is Abby Odom. So what is the Rogerian approach and motivational interviewing? To begin, the Rogerian approach was a therapy that was developed by Carl Rogers. Rogers was a therapist in the 1940s in America. In 1947, he was elected as the American Psychological Association's president, and during that time, he developed a theory that he founded in his own clinical experiences. So as he was practicing, he found that this worked really well for him. He emphasized that his theory should be rigorously tested and as a treatment and be subjected to intense scientific experimentation and criticism. He didn't expect this approach to be inducted immediately as a treatment because he really wanted it to be looked at scientifically and not just taken as fact. It was really important to him that it was studied and its success was looked at. And this was really, really different for the psychological world. It wasn't very common back then to look at different therapies scientifically and study their efficacy. So this was really different, and it led to a new way of looking at psychology. So after he had his theory studied and tested in other treatment cases and viewed intensely by other psychologists and scientists, it was developed by Carl Rogers as an approach to therapy. Its greatest focus was on the therapeutic relationship. So Rogers believed that a healthy therapeutic relationship was the key to treating his patients, and that without that relationship, a change would not be possible. The core values of what came to be known as the person-centered approach revolved around supporting and nurturing the relationship between the therapist and the patient. This was intended to help the patient reach self-actualization, which Rogers stated was a balance between self-image, self-worth, and ideal self. He also developed his perceived 7 principles of a good life. These included, number 1, an acceptance of all experiences, including those that are new. 2, an existential lifestyle that focuses on the moment and the present life. And 3, a trust level with one's own decisions and choices. And 4, a growing freedom of making those choices. Number 5 is creativity and adaptability without without confirmation. And then reliability and constructiveness in dealing with other people. And last but not least, a preference for living a rich and full life. So those are his 7 principles for a good life. All right. So motivational interviewing. MI, as it is also called, had a similar start to, when compared to the person-centered approach. This intervention style was developed after William Miller studied the correlating factors that determine the success of addiction patients in therapy. So in short, Miller saw what was effective in practice and turned it into a working treatment. The first definition of this therapy was synthesized by Miller and Rolnick for the first time in a 1991 textbook. Motivational interviewing focuses on the therapeutic relationship like the Rogerian approach, which is why I felt that they would pair very well together in future interventions. So the core concepts of motivational interviewing rest within the spirit of MI. The spirit of MI is characterized by 4 crucial parts. So the first is a compassionate approach by the counselor. When the counselor enters the therapeutic relationship with compassion and empathy, it is evident to the patient and contributes to the close and trusting relationship that is emphasized in MI. The second portion of the spirit of MI is collaboration. The counselor is not a cold, distant advice giver. They are a listening ear that cares, understands, and works alongside the patient to set and achieve goals. It is a cooperative partnership, and it allows the patient to feel supported and prevents feelings of isolation. Among compassion and collaboration are also autonomy and the belief of evocation. Autonomy is the ability of the patient to formulate their own decisions, goals, and their personal and sole responsibility to enact change in their actions. This not only means that behavior change lies solely within the client, but it also means that we as a counselor must give them direction that is not unsolicited. So when we offer direction to the patient, it is their ability to reject that advice or request that none be offered. This supports the partnership that's established between the counselor and the counseled in the therapeutic relationship. Also, in MI, it is imperative that although the responsibility of the patient is to enact change within themselves, it is the responsibility of the professional to partner with them. As I was saying, that's the collaborative portion of MI, and it's very, very important in making sure that the therapist can give direction while also supporting and respecting the patient. The final portion is belief evocation. So belief evocation entails the drawing out of the patient's thoughts and beliefs instead of the counselor giving them thoughts and beliefs and telling them exactly what should be done and how they should feel. It's unlike some other therapeutic methods that it does not consist of a counselor giving activities and goals or commands, like I said, to the client. So they're not quite as authoritative. It's more of a partnership and a relationship. The motivation of change through motivational interviewing is often achieved through demonstrating discrepancies in patients' beliefs. So kind of showing them that what they feel about themselves now, like where they see themselves now and where they would like to be, showing that those are two different things and then change needs to happen to get them to that point. The person-centered approach and motivational interviewing are similar. They both rely heavily on empathy and compassion that is felt and demonstrated by the counselor. So not only do they need to feel compassion and empathy for their patient, but they also need to express that. Both of these methods were derived from rigorous scientific study and clinical experience and success. They both emphasize the therapeutic relationship as well, which influenced my decision to use the Rogerian theory as a supplement for future motivational interviewing practice. Both the person-centered approach and motivational interviewing use the relationship between the therapist and the patient to induce change in the client. I definitely like this a lot. I really like the focus on the therapeutic relationship. However, both of these ideologies do have some differences. For example, the person-centered approach prohibits question asking on the part of the counselor. This deters them from finding belief discrepancies or advocating beliefs in the patient. It also emphasizes self-actualization as its direct means of inducing change in the client, while motivational interviewing, on the other hand, encourages reflective listening, which involves asking questions and clarifying meanings and even guiding conversation. It also induces change talk in the client and evokes beliefs that motivate the client. And this is what causes personal change in motivational interviewing. Also in MI, the therapist and the client will work together or collaborate to formulate goals and plans for behavior. So those are some of the differences between the two. So when it comes down to the person-centered approach, I favor it as a general therapeutic background, more like a backdrop, not as much as a fully structured style of communicating with my clients. This method is beneficial in practice by using it as a template to seek accurate empathy and fully understand my clients while refraining from berating them with unwarranted advice or undue authoritative direction or blame. It would not be my intent to use this method, however, without flexibility. I believe some patients desire more direction and guidance than is allowed in the person-centered approach. I do anticipate it working well in the background of motivational interviewing. MI was born long after the Rogerian method, but with its ideals in mind. As MI is utilized as a technique and approach, the Rogerian method would be an ideology in the backdrop to ensure that my focus lies on respecting the client, retaining accurate empathy, and using reflective listening as a way to draw out what the patient desires for themselves. So that's just why I felt that using the Rogerian theory would be beneficial in implementing MI, because it would keep me respecting the client and not giving them advice that is unwarranted or inappropriate at the time, and would also keep my focus on how they are feeling, how they are thinking, and what best way to help them reach their goals. So here are some of my references for this project, and I really hope that you guys learned some things about the Rogerian theory, and that you have a great evening.